One of the greatest public policy failures of our time was the closing of our state's mental health institutions without the provision of adequate community-based care in their stead. And this resulted in a large number of seriously mentally ill people, many of them homeless and suffering from co-occurring substance use disorders, being on our streets and coming into contact with law enforcement. And oftentimes those confrontations can be disruptive, they can be dangerous, and occasionally they can be deadly. The Mental Health Services Oversight and Accountability Commission studied this problem and has issued this report specifically designed for law enforcement administrators, county officials, members of boards of supervisors, members of the state legislature, the governor, and interested persons throughout California. And the report is not a comprehensive one on mental illness, but rather is one that encapsulates what the problem is and provides a roadmap for solutions to this pervasive problem that challenges all communities in California. We recognize that there is not likely going to be a single new source of funding that will allow communities to address this problem. And during the course of our studies, we went to other communities throughout the United States and saw how they were addressing this problem. And we were very impressed with communities that recognized that alone they couldn't solve the problem, but together they could pool their resources, they could pool their expertise. And what we saw was county government, city government, hospitals, nonprofits, faith-based communities, private donors, everyone coming together and taking a piece of this problem and being part of the solution to it. And our recommendation in our report is that California counties do just that they work together collaboratively to bring major stakeholders to the table, to pool their budgets and their resources, to make sure that they have adequate alternatives to criminal justice involvement for people who have mental illness, and to put that plan into motion. The report contains 6 recommendations of how counties can come together and work with the state to address problems in their communities. And we recognize that not every county is going to be able to do every recommendation, but we have identified 3 priorities that we feel should be the goal of each county to work towards. Number 1 is to work collaboratively together to address this problem, to pool their resources and their budgets. The Stepping Up initiative is one way that county stakeholders can come together and work together to keep mentally ill people from becoming involved in the criminal justice system. The second priority that we're asking counties to look at is developing alternatives to custody for people with mental illness. We need to have places that we can divert people to instead of taking them to jail. And this includes crisis intervention services, it includes community-based treatment programs, it includes assisted living and housing programs that can serve as an alternative to putting someone in jail. The third priority that we would ask counties to look at is to address the problem of people who are incompetent to stand trial being held in jail. Our jails, which are already overcrowded, are filled with people who are mentally ill and incompetent to stand trial. And until their competency is restored, they oftentimes remain in jail. So we're encouraging counties to develop county-based or community-based treatment programs that can help people be restored to competency and get them out of jail and into treatment. We need to recognize that this problem is long-standing, it's multifaceted, it's complex, and it's going to be expensive to solve. And it's unlikely that one single person or entity is going to be able to come up with a solution. But we believe that the answer lies in the title of the report, that together we can.